Uh, Very good evening, my dear students. Yep. So a very warm welcome from my side, Dr. Shivani Jain, and everybody at DocTutorials. Guys, a very good evening. I'm sure you are preparing very well. You are doing everything what any student should do before your exam. So very few days left for FMG exam and just 3 days left for NEET PG. So the D-Day is actually about to come, isn't it? And today, like I am here to have a discussion on some doubts which you may have in ophthalmology, or if you don't have anything, then I have a list of topics which everybody should be through, before your exam. Every student, be it a NEET PG student, be it a FMG aspirant, all the students should be through with these kind of topics. So I have prepared a list. Just before you go to exam, just see that you have done, make a tick mark, you've done all those topics or not. All right. I'm sure that you've done your PYQs as well, at least 3 revisions of your PYQs. If you haven't, give it some time. Again, go through quickly all the PYQs, okay? No mistake from your PYQs, right? Good evening, Bache. Good evening, Dr. Nidhi, Dr. Alam, and so many out there. I am sure that, guys, I'm not going to waste your time much. I know your time is very crucial. So, welcome everyone to the session. I'll go very quickly. We will clear whatever doubts you have, right, bache? Okay? Any kind of doubt regarding your preparation, anything which you wish to ask in the subject, you can ask me now. All right? First, I'll be taking up your doubts. Then I'll start what I want to tell you without wasting much of your time. So welcome to the session, everyone. So at DocTutorials, every day we are dealing with one subject. We are taking your doubts. Whatever list of important topics our faculties, they've been giving all the important topic list. So whatever verification, whatever doubts, whatever controversial questions which are there in the subject, please, you can ask me today. So if you don't have anything, let me start and take the discussion forward. So I have made a list of all the important topics which are not only important for NEET PG students, but also for our foreign medical graduates. Okay. So what these are? So friends, first I would say trauma, emergency medicine. So we have here traumas, whatever important emergencies in ophthalmology, whatever emergencies we have in ophthalmology, emergencies you must know. Okay, emergency. So it includes trauma also, right? Now, open angle glaucomas, I'm expecting again some questions. So last year we were getting many questions from glaucoma. So this year also, secondary glaucomas and open angle glaucoma, very important. Secondary glaucomas, I consider that, NEET PG, they can give you a question about secondary glaucomas. Now, refractive surgeries, again, expecting one question from refractive surgeries. Last year we had something on RK. They have been asking you about LASIK. They can ask you about SMILE this year. Okay? So I'll take up SMILE also once I proceed towards the discussion. Congenital cataracts, again, important. They can ask you anything about this topic, how to manage, when to do surgeries, right? Cataract surgery again, okay? Surgeries, instruments, they are giving questions every time, right? So cataract surgery is one thing which, you may have something from that. Now, something from oculoplasty, proptosis has always been an important topic. Ptosis, I'm expecting maybe one question this time they give you from ptosis, okay? Now, watering in newborn. Last year also beautiful question from watering. This year also I said they give you a twisted question from watering in newborns, photophthalmia, and so many things. So watering in newborns, again, an important topic. Images, you may have one from retina. I consider probably they can give you something from retinal detachment, retinitis pigmentosa. CRAO to ab पूछ चुके हैं. CRAO, they have asked you twice. Bullseye maculopathy is another important topic you can have, right? ठीक है बच्चे? Now cornea में से two topics always important: corneal ulcers, anything from the corneal ulcers, any ulcer, and keratoconus. We expect one question, guys, from keratoconus again, right? Now, dyes in ophthalmology, right? So you had one question like, what is the sequence of dyes, है ना? Last year, This year, FMG, you had question fluorescein dye, which light, cobalt blue light. So they may give you any question on dyes. So dyes in ophthalmology again becomes a very important topic. Then extraocular muscles, yoke muscles, synergist muscles, what are the contralateral synergist, etc., etc. So everything about the extraocular muscles, their origins, their insertions, their nerve supply, their actions, everything about extraocular muscles. The means I want that you should know what are the basics in squint. Okay, so basic in squints you should know. Again, visual field effects, bache, you may have a surprise question as visual field effects, anything. They can give you something from the picture of the visual fields or the complaint what the patient believes whenever he has a visual field effect or a lesion in the visual pathway, or maybe something from blind spot, something from glaucoma, anything like that they can give you. Now, abnormal pupils, always my favorite question. Expecting again one question from abnormal pupils. So guys, this is the sum up list of everything which everyone should have a check mark before you appear for the exam. Okay? So this is first thing which is from my side. Now, again, I'm inviting any doubts, anything you wish to ask me, bache. Before I start, हाँ जी, कैसा चल रहा है preparation is going fine, happy with your preparation. So be in a very positive mood, बच्चे, before you go to your exam. Don't talk much, है ना? Be very calm, very composed, and have a very positive mindset. You know, once you have that negative feeling, once you have that negativity in your mind, you won't do good. Whatever you have learned, whatever you have prepared, you'll also forget that. Okay, so be happy, be confident that you have done a lot. आप अच्छा ही करोगे, है ना? Whatever you will do, that will be the best day ever since, है ना? हाँ जी, again, anything? No doubts? Ophthalmology is done. So 15 questions, 15 marks is in your pocket now. Yes? Trachoma, see, not expecting many questions from trachoma, but if they ask you, they'll give you simple questions. Trachoma may save strategy पूछ लेंगे. They may ask you a picture question on maybe arts line, maybe 𝗗𝗵𝗫𝗀𝗃𝗧, something about the findings. See, trachoma has been now an old topic because we have eliminated trachoma from India. So probably from our country now, they won't give you trachoma, but you never know, है ना? For our FMG students, trachoma is definitely an important topic. Okay. Good evening, bachas. Good evening, all of you. So shall I proceed for this? Now, students, what I'm catering mainly students. FMG wale bache hain aaj, or we have NEET PG students today? Neurophthalm, I told you, I want you to learn everything about the visual field effects and abnormal pupils. Yes, something about the visual fields, the blind spots, abnormal pupils. You know, we have done 4 abnormal pupils. You should know Marcus Gunn pupil. You should know about Argyll-Robertson pupil. Then we have this tonic pupil, how to test this tonic pupil. What are the special things about tonic? What is a Horner pupil? ठीक है ना? ये तो पता ही होना चाहिए. And visual field effects, ever since this is an important topic, but they won't give you simple questions like pituitary tumor में क्या होगा. They won't ask you such questions, right? They may give you a problem-based question, what the patient's problem is, or they'll give you a field effect, a picture question, है ना? So just like that. न्यूरोफ्थैल तो इम्पोर्टेंट है ही बच्चे, है ना? वन क्वेश्चन तो आता ही है. एनी एग्जाम यू गिव, FMG, NEET PG, one question we expect every year and we are getting it. This time in NEET PG, I'm expecting one question from abnormal pupil. Right, guys? So you keep on asking your doubt in between. I'll take up your doubts. But without wasting time, today what I have, this is mainly for our NEET PG students. I'll give you very quickly a glance about the new questions, okay? Which generally we do not take in our regular classes, which generally you may have missed, you know. So not bombarding you with something new. I'm just giving you an overview of something which probably you have escaped. है ना? Considering that you have done a lot, you know everything. So I'm just giving you an overview of some new topics, new questions. Let us quickly go through it. Okay, bacha? In between, I'm inviting whatever doubts we have. Please write down in the chat box so that I can take up your doubts because this is priority. and doubt clearing is my priority, right? Most common ocular, क्या बोला बच्चे? What is the most common ocular? I can't see that. What is the most common ocular? बच्चे आगे क्या लिखा है? Morbidity क्या होगा? It's a refractive error. Morbidity. In children also, it is morbidity is refractive error. Worldwide, it is refractive error. ठीक है? Morbidity मतलब क्या? Morbidity मतलब pathology, बीमारी. So in children also, we have refractive errors these days. Okay? Clear? Chalo guys, so let us quickly start with this. So first question, the first very important topic is about the Fuchs heterochromic iridocyclitis. Guys, so just an overview, what is this? Heterochromia. What do you mean by heterochromia? Difference in the color of the iris. Can you see that? And this is a iridocyclitis. That means this is a type of uveitis. Uveitis, this is an anterior uveitis. Now guys, what is special about this Fuchs heterochromic iridocyclitis? This is basically a atypical uveitis. Why atypical? Because cells and flare are very minimal. Understood? Normally, when I see anterior uveitis, I see many cells. I see a lot of flare. I see keratic precipitates. But this is one type of uveitis where the inflammation is very, very less. So inflammation is very less. And I also see that there is a change in the color of the iris. So this was named by Fuchs. So whenever you have such an atypical presentation of uveitis, where the patient has a minimal inflammation and change in the color of the iris, please think about Fuchs heterochromic iridocyclitis. ठीक है बच्चे? Expected question, NEET PG, right? Yes, beta, both in children and adults, most common cause of ocular morbidity would be refractive errors. ठीक है? पक्का. Right? Dr. Shreya, you want to learn optic tract and chiasmal defect? So I'll take up that also. Okay. Yes, Dr. Shreya, I'll take up that. Now, the second question, a new question. What about glaucomatocyclitic crisis? What is this 𝗂𝗂 syndrome? So please remember, this is another atypical uveitis. Okay. What is this atypical uveitis? Again, we have very minimal anterior chamber reaction, very minimal cells, but inflammation is less. But what we see in a patient, in a young man, we see a very high intraocular pressure. So this level of inflammation is not matching with a high amount of pressure which we see. Okay, so what I see, what will be the question? A young man coming to you with a blurring of vision. When I saw the pressure was very high, the pressure is high, there is no other finding. You don't have optic disc problem, you don't have visual field abnormality, but the moment you check on the slit lamp, you will see inflammation. And the inflammation is also very less. All right, friends. So this is a kind of atypical uveitis where the high pressure is because of trabeculitis. Trabeculitis is nothing but the inflammation of trabecular meshwork itself. So trabecular meshwork itself is inflamed. That is why the pressure becomes high. Okay, so we have discussed two types of atypical uveitis. The first one is Fuchs. The second one is 𝗂𝗂 syndrome. Okay. Now, what is the third question? Let us talk about it. So I've got many queries about this question. That's why I'm taking up this. Okay, bache? So this was a repeat question of PYQ. I want everybody to understand. So bache, the moment you see such a protrusion, such a lesion on the sclera, you are confused whether it is 𝗡𝗨, whether it is only blue sclera, or whether it is 𝗓𝗨 perforans. So I would say whenever you have a bulge on the sclera, a bulge means you have a 𝗡𝗨. Okay? The history, the presentation of the patient may be same. What will be the presentation? An old patient, especially a female patient, having a history of long-standing rheumatoid arthritis. So you may have the same history in both of them. दोनों में same history होगा, same presentation होगा. But Staphyloma would be a protruding lesion and scleromalacia would be a flat lesion. Can you see that? It's a flat area. It's a flat area, no protrusion. So I'm sure you know everything about scleromalacia perforans because it is a PYQ. You should be through with it. Okay, bache? What is scleromalacia perforans? It's a very different type of scleritis. It is an anterior necrotizing scleritis without inflammation. There is no inflammation, but there is a necrosis. Why necrosis? Because there is an obliteration of the blood supply. So blood supply nahi rahega to necrosis ho jayega, and that is why you get a necrotizing scleritis without inflammation. The history remains the same. What was the history? Elderly female having a long-standing history of connective tissue disorders, rheumatoid arthritis. ठीक है बच्चे? स्क्विंट में क्या पूछ सकते हैं डॉक्टर रामकृष्णा? वेयर व्हाट डू यू वांट टू नो बच्चे? स्क्विंट में सी इफ यू आर अ एफएमजी स्टूडेंट they may ask you first of all the extraocular muscles and their actions. ठीक है? You should know yoke muscles, concept of synergist muscles, origin, insertion, what are the actions? First of all, very basic thing, extraocular muscles. Second, they can ask you different type of squints. What is esotropia? What is exotropia? Then third, very important, they can ask you nerve palsies, third nerve palsy, fourth nerve palsy, sixth nerve palsy. How the patient presents, the picture questions they can ask you. Hey? Okay. The next and the last one is maybe they can ask you something about, little about the management. That's it for FMG students. But for our NEET PG students, every year they are bombarding you with a new question in squint. I have 2-3 new questions on squint. We'll be discussing that. Okay? Whatever I have told you is equally important for our NEET PG students. Okay? No, Dr. Vinay, for you. Dr. Vinay, history of rheumatoid arthritis will be in both. Staphyloma में भी होएगा and scleromalacia perforans में तो होएगा ही होएगा. Okay? So the history may be same. That's what I'm saying. The history may be same in both. But in ciliary staphyloma, either you have a history of rheumatoid arthritis or you may have a history of trauma. All right. But in scleromalacia perforans, mostly a rheumatoid arthritis. The history may be same. ठीक है ना बच्चे? ये भी तो scleritis के बाद ही हुआ है. This has happened after scleritis. And this is obviously a scleritis. Understood? Chalo, quickly the next one. So a new question again for our NEET PG students. So guys, please remember, if at all they give you such kind of chart, don't get confused. This is not a Snell's chart. Okay, what is it? Just remember the name. This is a 𝗙𝗪 and 𝗬𝗪 chart. We can also call this a ETDRS chart, early treatment diabetic retinopathy study chart, or a logMAR chart. Okay, बच्चे, just remember the name. Now, quickly, I'm telling you what is the difference between Snellen's chart and logMAR chart, how to remember. So, Snellen's में क्या होता है? The first line has 1 letter, the second line has 2 letters, the third line has 3 letters, something like that. But what do you see here? Every line has 5 letters, same. So, every letter has been given and its own importance. इस लेटर का अपना इंपॉर्टेंस है. दिस लेटर हैज इट्स ओन इंपॉर्टेंस. ठीक है? दिस इज वेरी इंपॉर्टेंट व्हेन यू डू रिसर्चेस, व्हेन यू डू पेपर प्रेजेंटेशंस. ठीक है? जब हम रिसर्च वर्क करते हैं, जब हम पेपर प्रेजेंटेशंस करते हैं, पब्लिकेशंस करते हैं, देन लॉगमार चार्ट बिकम्स वेरी वेरी इंपॉर्टेंट. अदरवाइज नॉर्मली वी आर नॉट यूजिंग लॉगमार चार्ट. ओके? Just remember the name, how to identify it. Okay? Now, another important question. What is this chart? So can you see, bacha, that every line has only 4 different type of letters. Every line has what letters? Only HOTV. So इस chart का नाम ही HOTV chart रख दिया. What is the name of this chart? This name is HOTV chart. Okay? Please remember, this is for toddlers. ठीक है? Toddlers who have just started going to school, they're starting learning ABCD, but they're not through with all the letters in ABCD. है ना? They are not comfortably reading X. They're not comfortably reading Y. So for these type of children, we have given only 4 optotypes, HOTV. ऐसा मानते हैं that HOTV are 4 letters which are identified very easily. Like T is this, H is this, O is this, and V is this. Okay? So please remember, this chart is for toddlers. Okay? New question. Just in case you have such new questions, you should be able to answer. Okay? The next one. हाँ जी. So I have given this question in GT also. GT में भी मैंने दिया है. What is this pin cushion distortion? बच्चे देखो क्या होता है. Very easy to remember. Whenever I use high plus numbers, high plus, like I am using plus 10 diopters, plus 15 diopters. Suppose if I'm using a very high plus power, what will happen? What will be the problem? Of course, I'll see the subjects, the objects very, very magnified. मुझे बहुत ज़्यादा magnified object दिखेगा. But और क्या problem होगा? What will be the other problem? The other problem will be that my peripheral lines, peripheral areas will twist like that. Can you see this, बच्चे? ये देख रहे हो? Periphery में क्या हो रहा है? What is happening to the periphery? The straight lines have become curved in the periphery. So very easy to remember. Pin cushion distortion is seen in high plus numbers. That's all you have to remember. Okay? Not going much into details of everything. Just reading quickly some new questions which you may have missed in your preparation. Okay? Now what is this? Another new question. Anybody? If you can tell me what is the name of this instrument? Equally important for FMG students. So what is this new instrument? ये क्या है? So guys, you've studied in Russia, you've studied in China, maybe you've experienced this. ये क्या है? So this instrument is called as horopter. What do you mean by horopter, बच्चे? Horopter is a kind of a refractometer, है ना? So instead of putting a trial frame and putting multiple lenses one by one, this is an automated instrument where the numbers, the powers keeps on changing. So you just ask the patient, is it clear? He'll say no. Then a new number will come up. So it is automatic. We don't have to do much. And it's very easy for the examiner and the patient to tell. We don't have to take out everything. All right, Dr. Rhythm has asked a question. How to differentiate between cover test and which one? Just a minute, bache. Cover test and uncover test. Okay, I'll tell you. Dr. Rhythm, I'll tell you. So, पहले ये doubts ही clear करते हैं बच्चों के. ठीक है? So, what is the difference between cover test and uncover test? I'll just take up that question. So, friends, remember the statements. Statements are also important. Cover test मतलब क्या है? Cover मतलब that you've just cover one eye. Okay, I'll take up the question. I'll show you a patient of squint and then we'll take up your doubts about optic tract and those. ठीक है? देखो बच्चों. So guys, now see these patients. Friends, are you able to visualize that this patient has exotropia? The left eye is going out. So this is a case of exotropia. Now, what is a tropia? Tropia matlab, it is a manifest squint. Manifest matlab that anybody can see. Exotropia. Tropia matlab manifest squint. So if I am not an ophthalmologist, I am a layman, I don't know anything about squint, but I can also see that this patient has a squint because it is so evident, it is so manifested, right? So we will call this exotropia. Now, I know there is a squint, but I just want to confirm. So I will do a cover test. So I'll put a cover on the normal eye, on the apparently normal eye. The moment I cover the normal eye, what will I see? The outward going eye will come into the center. क्या था पहले बच्चे मेरी तरफ देखिए क्या था. So this was the picture. Left eye has exotropia. The moment I cover the normal eye, the left eye which was abnormal comes to the center and take up the fixation. So can I say the inference is cover test confirms tropia. You know there is a tropia, but just to confirm, you do this test. Now, what do you mean by uncover test? Okay, so uncover test is another very, very important topic. I'll just show you what is happening here in the uncover test. Okay. Hanji. So, have a look at this patient. Here, we don't see any squint. So, tropia is not there. But there is a patient who has a phoria. What do you mean by phoria? Phoria means a hidden squint. वो छुपा हुआ है. It's a latent squint. It's a hidden squint. So when I look at the patient, I see everything is normal. Both eyes are straight. But this patient has a tendency to squint. There is a hidden squint. There is a phoria. Now, what do you mean by phoria? Phoria is a tendency to squint. That means whenever the eye goes in rest or whenever one of the eye is hidden. आप एक आंख को छुपा दो, एक आंख को कवर कर दो. Whenever one eye is covered, the fusion is broken. So this eye which is under cover will have a tendency to squint. Now, the moment you cover the eye, this eye will go into the position of rest. So what will happen? The moment I cover this eye which has a tendency to go out, it will go out. Now, when the left eye go here, the right eye also moves here. Yes or no? I can't move my only one eye. My both eyes will have to move together. So when the left eye go here, the right eye will also follow it. Both the eye will go here. Now, the moment I cover the covered eye, जैसे ही मैंने इसको cover किया, what will I see? This will move to the center and this will also move to the center. So the moment I cover this eye, there will be a movement of the eye. Okay. So this movement of the eye tells me about that there is a phoria, there is a hidden squint. Have you understood? So can I say cover test is to confirm tropia? Uncover test is to see there is a phoria or not. Have you understood? It's an important topic, guys. Dr. Rhythm has asked a wonderful question. See, Dr. AM, cover test and uncover test is not done for amblyopia. Rather, we do patching for the treatment of amblyopia. This is called as covering. This is called as patching, not the cover and uncover test. Dr. Rhythm, is it okay? Dr. AM, is it okay? All right, everyone. Chalo, theek hai bache. So remember the words. The words are very, very important words. Okay, now I'll tell you a question which she has asked. The question on optic tract and chiasmal defect. So I'll just take up that quickly. So let me ask you one question first. Let me ask you a question. Okay, chalo isko dekho aur batao. If they give you this picture question, I am asking you, Hanji, Dr. Shreya, can you tell me where is the lesion? Where is the lesion? If I just give you this field defect, can I call this field defect to be the bitemporal hemianopia? Can I call this bitemporal hemianopia? So where is the lesion? Where is the lesion? Can I say the lesion is in the central part of chiasma? Can I say that? Because the central part of chiasma has the nasal fibers. So if nasal fibers are lost, we get a bitemporal hemianopia. Everyone, am I clear? Everyone, am I clear? Okay, so this is a picture question, or they can ask you simply what will happen if the central part of chiasma has a lesion. Central part of chiasma, you know, it may be compressed by the pituitary tumor, it may be compressed by the craniopharyngioma. Central part of the chiasma has nasal fibers of both the sides. So if nasal fibers are gone, the temporal field is lost. Now, what about optic tract? So I'm showing you one more picture. Now, my question is this. What is this visual field defect? Can anybody tell me? Can anybody write down what is this visual field defect and where is the lesion? Where is the lesion? Hanji, where is the lesion? I'm asking you two questions. What is the name of the visual field defect and where is the lesion? Okay, so the field defect is here, the right homonymous hemianopia. Right homonymous hemianopia. Why right homonymous hemianopia? Because guys, can you see that this is the left eye visual field? This is the right eye visual field. Here, the right temporal part is lost and here the left nasal part is lost. So can I say this homonymous hemianopia? And this hemianopia is on the right side. So I have named it a right-sided homonymous hemianopia. Now guys, whenever we have right-sided homonymous hemianopia, it is generally seen in the lesion of left-sided optic tract, left-sided LGB, left-sided optic radiations, and left-sided visual cortex. So all the left-sided problems which are after the chiasma, we'll see the contralateral homonymous hemianopias. But what is the best one here? If I give you all four options, the best one out is left optic tract. Okay? As we go posterior towards the visual cortex, the vision is less compromised. That means vision is better. ठीक है बच्चे? We also see a macular sparing homonymous hemianopias. Can you see? Beautiful picture question. Can you see here? This is again a right homonymous hemianopia, but this is with macular sparing. I hope you've understood this topic. Macular sparing. ठीक है ना? Right? So this was about the doubt that Dr. Shreya has asked. Dr. Shreya, are you getting it? Any other doubt, bache? Anything which you wish to ask me? So these type of questions, you know, the picture questions can be there in the exam, or they can ask you in FMG exam, very important topic. I tell you, visual field ke liye, the patient is not able to see the right halves. The patient is not able to see on the right side. So these type of questions can be there. All right. Chalo. Now, from my side, what is my next question? I want to give you an overview about this expected refractive surgery. So you are well aware about LASIK. Last year, we had a question on RK. So you must be knowing what is RK. You must be knowing what is LASIK. But I want to tell you what is this relic smile surgery. So this may be an expected question in NEET PG and FMG exam as well. Now, this is a new refractive surgery which is called as small incisional lenticular extraction. Okay, what is smile? It is small incisional lenticular extraction. Please remember, in LASIK and other refractive surgeries, we are using excimer laser. है ना? We are using excimer laser. But this is one surgery where we are not using excimer laser. We are not doing the corneal thinning by excimer laser. We are not doing that. Instead, we are creating a lenticule inside the corneal stroma and just taking it out of the eye. Okay, so the advantage of doing a relic smile as compared to LASIK is that in LASIK surgery, we are making a 20 millimeter incision on the cornea. We are raising a flap on the cornea, right? But in smile surgery, we are making a very small smile shape incision on the cornea. And we are creating a lenticule inside the corneal stroma like that. And just by the help of forceps, we are taking the lenticule out. Can you see here? This thing is the lenticule which we are taking outside. Okay. So if at all you get this picture question in your exam, or if they ask you about relic smile, you should be ready with 2-3 things. First, what is smile? Small incisional lenticular extraction. Second, in smile, we are not using excimer laser. So the chances of complications are very, very less. Hardly any complication. The chances of dry eye are also very less. Okay. Dr. Rhythm, I know ophthalmology is little tough, but it's a very interesting subject. See, if you feel low about it, if you feel less confident, nothing will happen. Hana, you should be I told you in the beginning of the session that you should have a very positive attitude about everything. Now the time of fear is gone. जो करना था वो पहले कर लिया, अब खुश होके exam दो. Whatever time is left, should be happy about it, should be confident that I've done. I'm just revising few things. I'm just giving an overview of everything. Okay? You will get questions from the topics which you have read. Believe me, you know everything. Hana? So have this confidence in life. You have done your part. All right. I understand that this is a little more clinical, little more complicated subject. But nowadays, bache, they are giving you very good questions, very good clinical questions. You know, from those 15, 16 questions, what we have in the exam, I'm sure 13 to 14 are very doable questions. A student who has read once the subject, who has revised once, he or she will be able to do almost every question. So don't have this kind of fear. Believe me. Okay? Dr. Rhythm and every student, बहुत अच्छा पढ़ाई किया है आपने. That's what you've been doing. Okay, so you will get questions from the topics which you have done. Give some time. Read your question very well. Do not make silly mistakes. That is my only humble request to everyone. Okay, don't jump into marking the answers. Don't do that. Hana, our silly mistakes sometimes creates a lot of problem and our rank goes down very much. All right. So patiently. You know, your examiner has given you questions thinking that every question should be given some time. It's not that just marking and jumping onto other. Don't save time like that, creating mistakes over that. Okay? Anything? Anything all more? Right, Homani, बिल्कुल ठीक बताया बच्चे. Yes, बिल्कुल ठीक बताया. So this is a picture question on smile surgery. Please remember that. Now, can anybody tell me if this is a visual field, what is the problem here? Can you look at this picture? Theoretically, bacha, they have asked you one question in NEET PG 3 years back. In which condition we have enlarged blind spot? So I'm asking you the same question with the help of a picture. Enlarged blind spot. I hope you remember enlarged blind spot can be seen in all the conditions where we have optic disc swelling, optic disc edema, like papilledema, like papillitis. Okay. Morning glory syndrome. So these are the conditions where we have enlarged blind spot. So you have to pinpoint what is the problem in this expected picture. Now, one more for NEET PG, not for our FMG students. They may not give you in FMG exam, but in NEET PG, long back, they have been asking questions about AION. So this time, if they introduce a new question, maybe AION is one of them. So what is AION? Yes, AION. Which may be arthritic or non-arthritic. So in AION, bache, you will get a altitudinal field effect. This is a very important visual field effect. Can you see the problem is only in the superior half? So the moment you have loss of a superior vision or an inferior vision, you think about altitudinal field effect, which is seen in acute ischemic optic neuropathy. Okay, bache? It's a loss of vision, but in a different manner. Either the superior half of the vision is gone or the inferior half of the vision is gone. Okay, so please remember, an old patient having a history of hypertension, CAD or diabetes mellitus coming to you with a field effect, think about AION. All right, everyone. The next question from me, what is Webino? So guys, I hope you remember that 4 years back, they gave you a question on 1.5 syndrome, NEET PG. So 1.5 syndrome ke saath hi, you must remember what is MLF lesion and what is this Webino. So this question is important. Neuro-ophthalmology for NEET PG, a new question. What is Webino? This we call it walled eye. Walled eye, bilateral internuclear ophthalmoplegia. So the moment you have a lesion of bilateral MLF, bilateral MLF, both the eyes are not able to converge, and what will happen? Can you see one eye is here, one eye is here? It appears that both the eyes looking towards the wall. That's why we call it Webino. Okay, just remember Webino word, walled eye, bilateral internuclear ophthalmoplegia. You have a lesion of bilateral MLF. Okay, please remember this. Now, can you tell me what kind of ptosis is this? What is this ptosis? Anyone? Hanji, this is a special kind of ptosis which is called as blepharophimosis syndrome. Okay? Why I'm telling you? Because 2 years back, you had a question on Marcus-Ganjow winking phenomenon. You remember? Marcus-Ganjow. There is an improvement of ptosis when you move your jaw to the opposite side. Okay, so that was Marcus-Ganjow winking phenomenon. That was a new question introduced in NEET PG. Now you can have this type of question, a new question where there is a severe ptosis and you have a phimosis. What do you mean by phimosis? Shortening of palpebral aperture, not only superiorly but also horizontally. So we call it phimosis. Phimosis मतलब shortening. आप देख रहे हो बच्चे इसमें? You see the palpebral aperture is shortened superiorly and shortened horizontally also. Apart from that, you have this which is called as epicanthic fold. Okay, this is called as epicanthus inversus. And the next one is telecanthus. You see increased distance between the medial canthus ligaments. This is called as telecanthus. So all these these 4 findings are seen in blepharophimosis syndrome. Okay, a new question here. Now my next one. What is this kind of squint? Equally important for our NEET PG and FMG students. Yes. A similar question was there in your exam last year. So can you tell me what is this type of squint? Yes. What type of squint is this? I would say this is rather the most common type of esotropia. Can anybody tell me what is this special type of squint? So friends, I'm giving you a hint. Can you see there is a esotropia in left eye, and it is actually corrected when the patient wear a special type of glasses. What are these glasses? These are convex glasses. So can I say this squint is absolutely corrected by giving this glass? So can anyone tell me what is it exactly? So this type of squint is called as refractive accommodative esotropia. So they can give you a picture question, or they can ask you theoretically, what type of squint is this? What is the most common type of? So guys, this is the special type of esotropia which is completely corrected by giving convex glass, because the problem here is patient has a high hypermetropia. So the patient has a high hypermetropia. He has to use his convergence to see objects for near. And the moment patient converge, there is a esotropia. So the moment I give corrective glasses, I give convex glasses, the effort of convergence is gone and the patient has an improvement in esotropia. All right. So this is a very special type of squint. Hanji. Dr. Vinay, yes, we can have AION in giant cell arthritis also. That will be arthritic type of AION. That's what you wanted to say? Hannah? That's a arthritic type of AION. We may have a question on AION this year. RP image is very important. Okay? We have retinitis pigmentosa, like also we can have associations of RP. I said gave you a question on RP. So I'm expecting more questions from RP this year in NEET PG. Maybe a problem-based question. Hannah? Anything else? So I expect that you have learned everything. Later on, friends, if you have any doubt, you can ping me on my WhatsApp number. And I'm also there in all the groups which DocTutorials have. So that's my WhatsApp number also. You can ping me here, asking me any doubts. I'm very much available at Instagram by the name of Ophthalmology by Dr. Shivani. So you can follow me here. I keep on asking you so many questions on Instagram, Ophthalmology by Dr. Shivani. Okay, friends? Later on also, if you have any doubts related to the subject, any question, anything which you haven't understood, please ping me there. So these are the list of topics and the questions which I've given you today. Just go through it once, give it 10 minutes. New questions for NEET PG students. Okay? Chalo. So that's all from my side. Best of luck, friends. I'm sure that you're preparing very well, and everybody should be Hanji. Everyone in the student, everyone who's preparing for the exam, you should do very, very well. Blessings from my side and everybody at DocTutorials. I will see you on the other side, bache. So best of luck. Keep shining. Keep doing. Can we get a revision PDF today? I've taken a very small session today, bache. This is mainly your doubt session. It's a very small session. Whatever you want, you can just go through it today. We are not giving PDF today, bache. All right. Today, I have just taken some new questions for our NEET PG students, a list of topics which you can take up from here. Okay. All right, friends. So take care. Best of luck. Do well in your exams.